Hello, my name is Patrick Sisawath. I'm a medical assistant, and today I'll be doing session 7 vital signs. Here to my left is my patient named Bruce Gloriani, who's going to be my assistant for today. Now, the first thing you want to do is you want to introduce yourself to the patient and also verify that this is the correct patient. Hello, my name is Patrick Sisawath. I'm going to be your medical assistant for today. Can I get your first name, last name, and your date of birth?
Christopher Robin, 1992.
All right, Christopher. So now that I've introduced myself and also verified that he's the right patient, now I'm ready to do for the blood pressure. So for the blood pressure, the systolic and diastolic number that is a normal rate is 120/60. You can go, if the patients either have above that normal rate or underneath, it's totally fine. But when it's too lower or too higher, then it's abnormal and there's something wrong with them. All right, so now we're ready to do the blood pressure. Can I have your arm onto the table for me? All right, so after taking Christopher's blood pressure, I have gotten 125/66. Now that is above normal rate, meaning that it is perfectly fine. He's not at pre-hypertension. So next up, we're gonna be taking Christopher's pulse. Now for the pulse, what you wanna do is you wanna follow along the thumb line, go just past the wrist, and underneath the wrist is the radial pulse. Now you wanna use 2 fingers, but apply just a little bit of pressure until you feel like a little pulse. Now, in order to calculate the pulse or find the patient pulse, you want to count for a minute to be exact, and after a minute is up, you'll get the final results. But there is, in some cases, where you can count for 30 seconds, multiply that result by 2, and then you get the final results. All right, so after counting Christopher's pulse, I have gotten 45 by counting 30 seconds. Now what I will do is I'll times that by 2, and 45 times 2 is 90. So he's at a pulse rate of 90 beats a minute. So now that we got that out of the way, we'll be doing his respiratory. Now for the respiratory, I will have the patient have his right hand over his chest, and I will always count every time he exhales out. So it'll be an over process of inhaling and exhaling. So basically the respiratory for the rate was the same thing as the pulse rate. So what you want to do is you can either count for a minute and get the final results, or you can count for 30 seconds, multiply that by 2, and then you get the final results. So now we'll be counting. All right, so after counting Christopher's respiratory, I have gotten 10, and then multiply that by 2, and now we get 20. So basically 20 beats per minute. All right, so last but not least is the patient's temperature. Now there are 3 ways to do the temperature, rather being it temporal, rectal, or oral. Today, we'll be doing oral. All right, so after taking Christopher's temperature, I have gotten 98.4. 98.4 is the normal temperature for every patient. If it's too high, being over 100, the patient may have a flu or a fever. And that concludes my vital signs.